ligaments of the lumbar spine. If you see ligaments of the lumbar spine, here almost same like our vertebral column as we discussed general. Here we'll be having same ligaments: anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, supraspinous ligament, interspinous ligament, and intertransverse ligament. So these are the ligaments which we can see in the lumbar spine. Apart from this, here we'll be having two special ligaments. Here we'll be having two special ligaments. Those ligaments. First one, iliolumbar ligaments. Iliolumbar ligaments. So these are the ligaments which are going to present between only L5 vertebra to the ilium of the hip bone. So these are the iliolumbar ligaments. And one more special structure to the thoracic region and lumbar region, that is nothing but thoracolumbar fascia. So this we have to see. First we'll see what are the specialties mean according to these ligaments mean. If we come to what is the specialty of these ligaments in relation to the lumbar spine, we'll see. If we come to the supraspinous ligament, suppose if we take vertebrae like this, so this is lateral view of the vertebra. So here we'll be covering the supraspinous ligament. This is spinous process, no, superior to the spinous process. So this is supraspinous ligament. The supraspinous ligament, if we take L1, L2, L3, L4, and L5, total 5 vertebrae. The supraspinous ligament is well developed. It is well developed in the upper lumbar region. And it is going to terminate. It is going to terminate at L3, L4. Terminate means from L3, L4 this ligament will be absent. Okay, this ligament will be absent. So mostly it is very strong at the upper lumbar region. Upper lumbar region means well developed, and it is going to terminate over the L3, L4 region. Most commonly L4 region. Here the ligament will stop. So here the ligament will stop. If you take L5 vertebra, here there is no supraspinous ligament. There is no supraspinous ligament. And here next point, if you see intertransverse ligament means, suppose if this is one vertebra, here we'll be having transverse process of the vertebra. So between this transverse process, we can see intertransverse ligament. So in lumbar spine, especially lower lumbar region, the intertransverse ligament is going to replaced by the iliolumbar ligament. So name itself it is saying the ligament it is going to present between ilium of the hip bone and lumbar region and lumbar vertebra. So these intertransverse ligaments in lower lumbar region are replaced by the iliolumbar ligaments. And here if you see cross sectional area means how much. Cross-sectional area means how many fibers are there in that ligament. So if we take cross-sectional area, the big cross-section, suppose if I take this is one bone, okay, this is one bone, this is one ligament, okay. Again I am taking one more bone and one more bone, this is one more ligament. So if we see here the cross-sectional area of this ligament is more, this ligament is big compared to this ligament. So same like that, which ligaments have more cross-sectional area in the lumbar region? First one, if you see, first place it is having ligamentum flavum. It is having the more cross-sectional area, ligamentum flavum. Second place, posterior longitudinal ligament. Posterior longitudinal will be having the second place. That means compared to ligamentum flavum, the cross-sectional area of posterior longitudinal ligament is less. So this is one point. And second point is stiffness. Stiffness nothing but the resistance. Suppose if we take one vertebra, if the vertebra is going forward, this is anterior, this is posterior. Okay. If the vertebral column is going forward, which structures are present on the posterior side? If these structures are not going to allow the vertebra to go forward, then we can say these posterior structures are helping for the stiffness of the spine. Understand? If the one vertebra is going forward, the structures which are present on posterior or maybe anterior, if these two structures are not allowing the spine to go forward further, then these two structures are going to helpful for the maintaining the stiffness of that vertebral column. So here stiffness, which structures will be having more stiffness means here joint capsules, okay, joint capsules, fascia joints will be there, no, fascia joint capsules will be having more stiffness in the lumbar spine. And second place, this is the most stiffness and the least stiffness. This is the more stiffness structures in the lumbar spine, and least stiffness structures in the lumbar spine means here we can see the interspinous ligament. So interspinous ligament will be having the least stiffness, and joint capsules will be having the highest stiffness of the lumbar spine. The special ligament is iliolumbar ligament. So what are these ligament means? Suppose if you take, this is our thoracic spine, this is our lumbar spine L4, and this is our lumbar spine L5. Okay, L5 we are seeing anterior. So here we'll be having L3 lumbar spine. So here we'll be having sacrum. Okay, sacrum. From here we'll be having hip bone. This is our hip bone. Otherwise pelvic bone. So this pubic symphysis, this SI joint. So here we'll get our hip joint. So this is our hip joint. Okay. Now if you see what is this iliolumbar ligament means, this iliolumbar ligament will be having total 5 bands. For total 5 bands this ligament will be having, and from where it will start means it will start at the tips. It will start at the tips of the transverse process, and borders of the transverse process. Tips of the transverse process and borders of the transverse process of the L4, L5 lumbar vertebra. Okay, L4, L5 lumbar vertebra. Here tips and borders of the L4, L5 lumbar vertebra transverse processes, and it is going to attach to the iliac crust. It is going to attach to the iliac crust. So that's why ilio-lumbar ligaments. So these ilio-lumbar ligaments are going to helpful in the flexion, extension, resistance. Flexion, extension, resistance. What it means, if the lumbar spine is doing more flexion or extension, these ilio-lumbar ligaments are going to provide resistance. That means these ligaments are going to stop the further more movement of the lumbar spine flexion and extension, and at the same time, ilio-lumbar ligaments are going to prevent the, or nothing but giving protection to the L5 vertebra for the anterior displacement. Suppose if we take this L5 vertebra and sacrum, this our sacrum, okay, this is our sacrum, this is our L4, L5 and sacrum. So if we see like this, so this L5 vertebra almost will come to anterior displacement. Sometimes this L5 vertebra will displace anteriorly. So the iliolumbar ligament which is present here, it is going to protect the L5 vertebra from the anterior displacement. So these are the ligaments of the lumbar spine, okay.